we're here with Taria. This is Dr. Hubner with Natural Transplants, and Taria has come from Maryland to our Washington, D.C. office to get hair treatment today, and we're very happy to have her with us, and she has agreed to share her journey with any potential clients out there or people that are discouraged about their hair loss and may have a similar situation to hers. So Taria, tell us about when you started losing your hair and what you've been kind of going through.
Sure. So it started back in 2005 when I had my first son, and then it kind of decreased, and then it started increasing again back in 2009, and that's when I realized that I was being diagnosed with having traction alopecia, and it's pretty much stemmed from, of course, wearing the weaves and not really caring for my hairline and allowing those that were doing my hair to kind of pull on my edges, and then just over time the hair just stopped growing. So
sure.
Now my hypothyroidism is playing a factor as well, and the only way is to have the transplant done, and so I'm excited.
Great. Well, we're really excited too. And Taria actually did go and get a scalp biopsy, which showed that her changes were consistent with traction, which is very important before you do a procedure like this. You want to make sure that the grafts are going to survive. So that was a very good thing to do. So tell us about your goals today, Taria.
So my goals are to be myself once again and be able to wear my hair freely. As you can tell, I have a lot of it, and I've been hiding all this hair for the past 8-9 years, and I'm ready just to be myself and just to let everybody see that I do have hair. So.
Oh my goodness, you have hair. Yeah, and the back of the head is ridiculous. So we're going to take some of that and put it where you want it. And then the last question for you, Taria, is how did you find out about natural transplants?
So I found out, I was doing some research because I was trying to decide exactly who would be the best doctor to actually do this treatment. So originally, as I was on YouTube, and then I started following Tanya, and from there on I did further research, and I was seeing all the reviews from the Florida office, and I was like, well, I guess this is the place where I need to be, because there was nothing but positive vibes and positive reviews, and that's where I would prefer to go and have the positive results as well.
Certainly, and we're very appreciative you came to us, and it's our patient first focus, and the videos and the pictures, they certainly don't lie, and we're really excited to follow you on your journey today for your surgery day, and then follow up with you as your hair starts to grow in and see those awesome results. So thanks again for sharing with us, and we'll check in with you throughout the day. Okay, we're here with Taria, and at this point we've drawn out her new hairline, or I should say old hairline. We just kind of put it exactly where it used to be, and I'll show you that. And you can see the nice round curvature of her hairline, coming down into the temple there. We're going to work back as far as we can today, with the understanding that we're going to get her as much hair as in the strip that we take, and we're going to take as much as possible. And yeah, so this is where we're going to put all those hairs. And Taria actually made a great decision of buzzing away those little tiny hairs that were in that area we're going to graft into. It's going to make her post-operative care much easier. She wasn't getting a ton of coverage from them anyway, but I know she was attached to them, so it was hard for her, but she made a good decision. And anybody who is going to get a tattoo or anything like that, it's always a good idea to just shave the area away. Keep it as clean as possible to be easy for you. So I'll also show you at this point, we have buzzed away where we're going to take the donor strip from. You can kind of see me in the picture there. And you'll see it's about 1 centimeter to 1.5 centimeters wide strip. And we're going to use as much of that path as we can, get her as much hair as possible today. So Taria, at this point in the day, how are you feeling?
Feeling great.
Excellent. So the next step will be getting us in the OR and getting you prepped for the first phase of the procedure. Great. Thanks again for sharing with everybody your journey today. Okay, we're back with Taria, and at this point in the procedure, we've removed the strip, we've sutured up the donor area, and we've created all the tiny little slits where her grafts will go. I can zoom in here, and you'll kind of take a look. You'll see all these little tiny holes is where the grafts will be placed. And let's see if we can move this out of the way. The lighting a little better here. And you can see we just jam-packed it in there on the front. Around the other side and show you. You can kind of get an idea of where her new hairline, her new edges are going to be. She's super excited. She was talking about going swimming without a cap for the first time in a long time, and all these things she's planning on doing. So we're super excited for you, Taria. And at this point in the day, how's it been for you? How's the experience been? And just let us know. Let everyone out there know what they can expect.
It's awesome. They're very gentle, and the pain level was at a minimal. If you have a high pain tolerance, but everything went well. A lot of laughter, and we're just having fun.
Yeah, and we had some food. She's had her support team in the room the entire time, if she wanted to be. And yeah, she's doing great. So we're gonna check up on you after all the grafts are placed. We'll go over all the post-op instructions. But thanks again for sharing with everybody. And what would you say to somebody who is kind of on the fence about doing this and taking the leap?
So if you're really considering it and you're going back and forth, I would just say do it. The outcome, as we go through this journey, the outcome will most likely be what you're looking for. And this is a great team that's here. And if you're in the local area, just come on through and have a consultation, and you can go through the same thing and experience great results.
Thank you so much, Taria. And just so you know, we didn't pay her to say that. All right, we'll be checking up on you in a few minutes.
All right.
Okay, Taria is all done. We just finished placing the last of her grafts. We got close to 850 grafts for Taria. Now, that may not sound like a lot when you're talking about grafts at other places, but our grafts have anywhere from 4 to 6, sometimes 8 hairs in them. So when we're talking about number of hairs, we're talking about many, many more hairs than that. So Taria, how was the day for you?
It was great.
Excellent. What were you doing the whole time?
Watching TV and sleeping.
Yeah, she got a good nap in, and we're really happy about that. Let me pan around and just kind of show the area that we were able to cover. So all those little dots are new hairs for her, where she never had hair, but where she didn't have hair when she came in. So we're really happy with the amount of coverage we were able to get. Now there's going to be a little spot in the back where she might have to pull the hair back, her new hair back, and cover that up a little bit. But she has got great hair to work with around that, where she'll be able to, if that becomes any sort of issue, be able to hide that very easily. So really just jam-packed it in there, especially in the front, got down into the sides. Nice, rounded off female hairline. So Taria, we're really excited to follow your progress, and hopefully we get the results that we're looking for, get you back in business and living life to the fullest again. Any last words of wisdom for your fans out there?
It was great. If you're thinking about it, no hesitation, make it happen.
Awesome. Well, thanks for coming in, and we'll be following up on your progress.
Thank you.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.